Right now, in hospitals and clinics all over, there's a quiet revolution happening. And no, it's not some new wonder drug or a fancy surgical robot. It's something much more subtle, but honestly, it could be just as powerful. We're talking about a new kind of digital copilot that's stepping into the exam room, and it's about to change how you experience healthcare. It really all boils down to one simple question. Just think about your last doctor's visit. What if your doctor could spend that entire time focused just on you, listening to you, talking with you, instead of being buried in a computer screen, clicking and typing? Well, that's the core promise of this new technology. So, what is this tech? Well, we're talking about a whole new class of AI. And this is not your everyday chatbot. These are secure, highly specialized tools built just for medicine. They're HIPAA compliant, which is just a fancy way of saying they meet super strict federal standards to protect your privacy. They're designed to be a clinical assistant, a co-pilot, sitting right there next to your doctor.
But you might be wondering, why do doctors even need a co-pilot? Well, it's because they're dealing with what some people are calling a paperwork pandemic. The amount of administrative work piled on clinicians has just hit a breaking point, and it's directly impacting the care we all receive.
And this quote right here, it just nails the problem. Think about it. Every single minute a doctor spends wrestling with a chart or hunting down the latest guidelines or filling out endless forms, that's a minute they can't spend talking to a patient. It's a trade-off, and right now, the paperwork is winning way too often. So what does this burden actually look like? Well, it's a nonstop flood of tasks. It's drafting incredibly detailed notes for every single visit. It's battling insurance companies for prior authorizations. It's trying to summarize a patient's entire complex history in just a few minutes, all while trying to stay on top of the latest medical research. It is a massive amount of mental juggling. Okay, so that's where this AI copilot steps in. Let's get into how it actually works, starting right where it matters most, in the exam room, when a doctor is figuring out what's going on. This is where you really see that partnership in action. So let's say a doctor needs to figure out which tests to order. The AI can instantly outline a focused plan based on your symptoms. Or if they're considering a few different possibilities, the AI can generate a list of potential diagnoses, even ranking them by how likely they are. Now, let's be clear. The AI isn't making the decision. It's just organizing all the complex information so the doctor can make a faster, better one. So what's the immediate result of all this? Well, it reduces what's called diagnostic uncertainty. Medicine is complicated, and the right answer isn't always obvious. By showing a wider range of possibilities, the AI acts like a crucial safety net. It helps the doctor double-check their own thinking and even consider rare conditions they might have missed. It's not just about being faster, it's about being safer. But here's the thing. The support doesn't end once you have a diagnosis, not even close. The real game changer here is that this copilot can help out across your entire healthcare journey, from that first exam all the way until you're safely discharged. Remember that paperwork pandemic we talked about? Well, here's the counterattack. The AI can draft the clinical notes automatically. That frees up the doctor to actually look at you and have a conversation. It can prepare your after-visit summary, and, this part is huge, it can write your instructions in plain, simple language that anyone can actually understand. And at the end of the day, this isn't just about saving your doctor some time. It's about creating a really clear, consistent line of communication that follows you, the patient, from the exam room all the way back to managing your health at home. That consistency becomes absolutely critical if you're ever moved between, say, the hospital and a rehab center. A bad handoff is one of the biggest sources of medical errors. But here, the AI can summarize your entire case and draft custom notes for every single new provider on your team, making sure everybody is on the exact same page. And what about keeping up with new research? Medical knowledge is exploding. In the past, doctors had to manually search through these super dense clinical textbooks. Now, the AI-assisted method can give them an instant summary of the latest evidence and even help figure out how those general rules apply to you specifically. So, when you put all of these pieces together, what does it actually mean for the future of healthcare? We're not just looking at some new gadget here. We are witnessing a fundamental shift in how medicine is practiced. The big picture benefits are pretty clear. For doctors and nurses, it means less burnout from all that paperwork. For us, the patients, it means more focused face-to-face time with our doctor. And for the whole system, it means safer care and quicker access to the best possible treatments. Now, I want to be absolutely crystal clear on this point. This is not about replacing doctors. The goal here is to augment human expertise. It's about letting the AI handle all the routine data crunching so that highly trained people can focus on what they do best: complex problem solving, showing empathy, and making that crucial human connection. And that leaves us with a really fascinating question to think about. As this digital copilot becomes a normal part of every doctor's office, how is it going to reshape the very definition of what it means to be a doctor? The role is evolving right in front of us. From someone who just holds all the knowledge to an expert interpreter and navigator with a powerful new ally right by their side.